The Trusculpt 3D is a radiofrequency procedure. The sculpt is thermal energy that we're pushing much deeper in the tissue, but it's not radiofrequency. Again, radiofrequency is usually a little more uncomfortable than other types of heat placed in the skin, depending on how deep they're able to penetrate into the skin. Trusculpt 3D, we've had this piece of equipment, probably about 4 years. Usually patients will opt for the Trusculpt 3D when they're looking for a piece of equipment that will last. So we have the Evolve X, and let's say we're treating an abdomen. Patient has to come in weekly for 6 weeks. With the Trusculpt, it's usually one treatment and then maybe yearly maintenance or every 2 years maintenance. They may, if they have a larger debulking that's needed, require 2 treatments, but there's fewer treatments up front and then less upkeep than some of our other non-invasive methods. So this is an external non-invasive body contouring. We have a licensed esthetician that performs the treatment. We divide the area of concern into quadrants, and we could treat up to 4 to 6 quadrants in one visit. Usually we try to stick to 4 or less. The first 5 minutes, we're really heating up the tissue. We have to get to very high temperatures for the Trusculpt 3D to be effective. So our patients that have been able to maintain a much higher degree temperature, they've been much happier with their results from the Trusculpt 3D. The Trusculpt 3D gets hot. So if a patient has a poor pain tolerance or they're not able to sit still for a long time, the Trusculpt 3D may not be the best treatment for them. There's other newer technology that is much less painful, but the Trusculpt 3D can be quite uncomfortable. But for some of our patients who have great pain tolerance, are really looking for that non-invasive body contouring that's effective, this could be a good method for treating their body contouring for fat reduction, and then it also does skin tightening. So if the Trusculpt 3D is done wrong, really the biggest concern could be a burn to the area. So if, God forbid, the patient burned, we would take photos, we would monitor it. I would see them myself as the physician. We would treat the burn effectively as you would treat a burn. We would see them frequently and then make sure they resolved. If for some reason they had an area of hyper or hypopigmentation, we would want to then possibly recommend or perform other treatments for that. Also, one thing that's common, but patients often do get fat deposits after this treatment. So if patient does have a nodule that forms under the skin, it's routinely a fat deposit. We would measure that area. We would take photos if it was something that was obvious externally. We have not had anything like that, but we're usually able to measure the fat deposit and then follow it weekly. And all of our patients, the fat deposit has resolved.